Fundamentally, health inequalities are caused by economic inequalities, since economic inequalities have an impact on other things affecting health, factors that health researchers tend to call the social determinants of health. These have been neatly set out in a diagram called the rainbow model of the social determinants of health. In this model, it's evident that our health is affected by the health services we encounter and by lifestyle behaviours, so whether we smoke, drink or eat unhealthy foods, for example. However, it also has a number of outer layers demonstrating that our health is also affected by things like our housing, our neighbourhoods, the jobs we do or don't have, and the products that are marketed to us. These things in turn are shaped by government policies relating to the economy. However, tackling economic inequalities through economic policies probably requires quite drastic social and political transformation, and I don't think public health can just sit back and wait for this to happen. We need to think about the practical steps that people in public health can take to reduce health inequalities. So what are more realistic steps for addressing health inequalities in the UK at the moment? Well, we know that the harms arising from smoking, alcohol consumption and unhealthy foods affect poorer communities more than richer communities. Smoking rates are, for example, currently much higher in poorer communities. So this seems like one potential entry point. Here I think we can draw some wider lessons from the experience of trying to reduce smoking through tobacco control. In this case, we found that such efforts are successful when they work to regulate and control the tobacco industry that produces, markets and sells tobacco products. It's clearly complex, and lots of people and organisations have some responsibility and roles to play. There's a damaging tendency to assume that addressing issues like tobacco, alcohol and unhealthy food points to a focus on individual consumers of these products. That would imply that individuals are seen as responsible for their own health experiences through their decisions to smoke, drink alcohol or eat highly processed foods. But if we go back to the rainbow model of the social determinants of health, we can see that there are important opportunities to improve health at each level. It's easy to caricature efforts to reduce smoking as focusing primarily on individual lifestyle factors. So smoking cessation in the UK has placed an emphasis on giving smokers access to nicotine replacement therapies on the NHS. But it has also sought to create supportive networks for smokers trying to quit, particularly within poorer communities. And tobacco control has also brought major changes in living and working conditions, protecting workers from second-hand smoke in the workplace. And the main drivers of people smoking less have been at the outer layers of the rainbow, so for example increasing the price of cigarettes through taxes or banning tobacco advertising and removing tobacco displays from shops. Big changes in things like smoking, drinking and eating clearly need policy action to be taken at a national level, such as action to restrict the marketing of unhealthy products. And this means that we're mainly talking about national governments, so the Scottish Government, the Welsh Assembly, but most of all, since it has more power, the UK Government. There can also be important opportunities in international policy arenas. So the World Health Organization has developed an international tobacco control treaty that the vast majority of the world's countries have signed up to. This aims to curb the expansion of tobacco companies in poorer countries, where global deaths and disease from smoking are growing. So we need to address inequalities between countries as well as within them. If we're going to make changes to reduce health inequalities in the near future, I think we need to have a practical focus. One attractive strategy that I think would be effective involves doing more to regulate those industries whose products damage health and generate inequalities. We're used to approaching tobacco policy in these terms, but we can also look to control the actions of producers of alcohol, unhealthy foods and soft drinks. Reductions in smoking show that we do know how to reduce consumption of health-damaging products. Some individual policy options have been quite issue-specific, like ending smoking in indoor public places. But core strategies can be applied in many other contexts. So we would reduce harmful consumption by increasing the price of alcoholic drinks or by radically increased restrictions on advertising and marketing of unhealthy foods. And given that deprived communities are clearly targeted by fast food chains and by the gambling industry, we need to think creatively about how local controls on the number of burger joints or betting machines might be used to reduce inequalities. All of this poses a challenge to powerful industries and is likely to be strongly resisted by them. However, the UK has taken important steps in working to ensure that the tobacco industry is not able to sit in on policy discussions and influence health policies. A similar approach is now needed for large companies that produce alcohol and unhealthy foods.